few pieces that need to be in place. First, the child's present levels of academic achievement and functional performance. Sound familiar? And then measurable academic and functional goals that will enable that student's involvement and progress in the general ed curriculum. And the services and aids that are needed to or on behalf of the child. That's a really important phrase out of IDEA, folks. We're going to be doing a lot with that. So, we're going to be talking about what's provided to or on behalf of the child to enable that child to be involved in and make progress in the general ed curriculum, and to, here's that other piece we know, to participate in extracurricular and other non-academic activities. So we need to be providing that information, where the kid is now, where we want the kid to be, and how we're going to make that happen in order to be part of the general ed curriculum, progress in it, and participate fully. Okay, so we talked earlier about the specially designed instruction. I want to stop for a minute here and look at what we're talking about. You'll recall when I said we're making eligibility determinations, question 3 was, will specially designed instruction make a difference? Is that what the kid needs in order to be able to participate and make progress? So what are we talking about here? Specially designed instruction is an adaptation of the content or the methodology or the delivery of instruction. In some way, we're adapting what's coming to the kid. We're not repeating, folks. We are adapting what is being given to the kid or how it's being given. And that adaptation needs to be designed to meet the unique needs of that kid. Not, you have a group going here, let's plug this kid into this group. All right? Really looking at the unique needs of this kid. We're going to be getting into that a lot more when we talk about workload. Okay? So, as you're looking at the adaptations for the unique needs of the kid, remember that they're based on the student's academic, developmental, and functional needs. And that modifications need to consider the need of the kid across those school environments. Again, here's the other half of your mantra: academic, non-academic, and extracurricular. We're going to keep saying that, you know that. So, as we're looking at the needs over these areas, where we want the kid to be participating, what are the implications of that? Part of that is the other piece that I had mentioned on that list, direct and indirect services, with and on behalf of the student. Let's look at what we're talking about here. This isn't just direct instruction or direct services. This isn't just pull out or pull aside. We're including indirect services on behalf of the kid. This opens a whole beautiful area of support that we need to be thinking about. As we monitor how the kid is doing, we consult to others, we collaborate with them, we support the curriculum, we support the context within which the kid is learning, we support the instruction he's being given. This may involve AAC and other forms of technology. The indirect services certainly can be combined with direct services as appropriate for each kid, so that the program is both individualized and it's comprehensive. I know that the indirect part is usually not considered with the IEP. There are some states and districts that are doing a great job of that, but the overwhelming majority of them are only documenting, requiring, capturing what you're doing in terms of direct services and never touching the indirect, which is a disservice not only to the kid but to you. We'll talk about that under workload. We're really looking at a way that you can combine service delivery models in order to meet the needs of these kids, to be comprehensive about it. And I would also argue, absolutely, to be more efficient in what you're doing. A little aside, we're really good at getting kids in We're not so good at getting kids out of services. And we really need to be focusing more on being more efficient with what we're doing with these kids, which means being more direct, which means being more individualized and comprehensive, to get them what they need, both in terms of direct and indirect, with and on behalf of them, and then get them out, okay, and on their way.